Good morning, guys. I hope we're all sparkly. I think it's safe to say that the NHS does not appreciate the importance of healthy male androgen levels for long-term physical and psychological well-being. I believe there are shortcomings in not only the diagnostic process, but also the treatment offered when you do have a confirmed deficiency. They offer a cookie-cutter approach, a one-size-fits-all methodology that does not appreciate biological individuality. We want stable male androgen levels all day, every day, to help facilitate function. That's what this is about: normality, fighting and fornicating. Now, the primary premises behind testosterone is to help facilitate growth and repair. It's to recover from the day to prepare for the next day. So you are better, you are capable, and that's what we want to achieve. So when you have fluctuating hormone levels, your body does not know what state it's in. So it has to adjust to those levels. So there is a physiological response to fluctuating hormone levels. So we want to avoid this. We want stable male androgen levels. I'm a massive proponent of microdosing, using the minimum effective dose in the most effective way to achieve stable levels. And in my mind, that is daily subcutaneous testosterone cypionate injections alongside HCG injections. The HCG is to maintain function, and we are optimizing your male androgen levels with testosterone. This should be the goal. So it's rather disappointing that you can buy Testogel over the internet with a couple of testosterone level tests. I do not believe that shows due diligence. And I also believe that Testogel is an ineffective treatment unless you use HCG to act as a base. So it's true that there is diurnal variation in male androgen levels. So you have a spike of testosterone in the morning. You also have a spike of cortisol because you're supposed to go and hunt and gather. So the HCG acts as a base, and the Testogel actually gives you that little bit of a spike. So it can be effective, but not normally. So the most effective way is injections, because we offer gold standard therapy. So you might go to other providers or clinics and be offered X, Y, and Z. You want to be very careful about this and understand why they are offering you the different modalities. Now, there should be a scientific rationale behind it, and if they cannot explain that, then walk away. I can give you a sound reasoning why I do what I do, and we have the evidence to back it up. It's incredibly important that you ask your doctor why they are offering you something. Just because there's been one paper to say a treatment modality is effective, they should be able to dissect that further and then apply it to every man. And the only way, in my mind, of achieving stable levels is daily injections of Test-CYP and HCG. Now, I don't mess around. So when you come to the men's health clinic, you will be faced with truths, because there's no point having a sales consumer relationship when you have a medical condition that is complicated and we are our own worst enemies sometimes. So it's inappropriate to say, what do you want to do all the time? You lack objectivity. I can be objective. And that's incredibly important when making decisions about your long-term physical and psychological well-being. Other clinics will tell you that it's all about how you feel. It's about how you feel, as long as that is not having a detrimental effect on your well-being. So all of my guys, I'd say 95% are on TSIP plus or minus HCG, or they're on testosterone enanthate, which has a very similar half-life because they get prescribed their medication through their GP. Got a couple of guys on libido, as I said, a couple of guys on testo gel with HCG. Most of my guys are on the same treatment. Why? Because it's effective. That's why. That really is the only reason. Well, I would prefer to use this. Well, I can give you sound rationalization why you shouldn't do that. So if you want to use transcranial testosterone cream, don't come to the Men's Health Clinic, because you will not receive it from us. The absurdity of applying 100 milligrams of testosterone cream twice a day to your scrotum to achieve stable levels, is absurd. Your body produces between 7 and 10 milligrams of testosterone a day. So if you think about efficacy, and you're needing 200 milligrams of testosterone cream to achieve stable levels, there's a disconnect there. You have to apply a little bit of common sense and logic to medicine, and not always go with, I want to feel amazing. We all want to feel amazing, but testosterone is the foundation. You need to put the hard work in. I will help you, I will guide you, I will support you, but I will not give you false promises. Now, I insist on a face-to-face consultation for our new patient consultation and yearly thereafter. The rest can be managed remotely via Skype, emails, telephone consultations, but I insist on a face-to-face consultation because I recognize how complicated testosterone replacement therapy is. Not really, actually how complicated life is, okay? And sometimes you do need somebody to break it down and give you a little bit of objectivity that you would not get elsewhere. This is not a sales-consumer relationship. Testosterone replacement therapy is literally a small part of what we do. It is a guide, it is support to help you make the right decisions. Now, my guys recognize this. We have patients from all over the UK. One of my guys transferred his care over from a doctor, and he now drives past his old doctor to come 4 hours to me every year. We have guys from Scotland, we have guys from Ireland, and we have guys from Wales. We have guys from all over Europe. In this last week, one of my guys came from Denmark for his annual review. It's a 1,500 mile car drive round trip because he recognizes the importance and the value of a doctor-patient relationship. Now, he did stop off at Amsterdam. Addy, I think he's stopping back off again. Yeah, it wasn't just for a jolly. We've also had a guy from the Netherlands last week, and again, he'd approached an online provider, and he could have been subjected to the usual, let's try transcranial testosterone cream, then let's add in an anastrozole, then let's try Testosterone, let's add in an anastrozole, why don't we try some thyroid support, you know, the usual stuff. But he showed due diligence, he did his research, and we had an email correspondence, and he felt comfortable travelling all the way from the Netherlands to the Men's Health Clinic into sunny Dorset. It is a beautiful part of the country. We have patients in Dubai, 2 in Dubai, 1 in Indonesia, 1 guy flew over from Hong Kong, and most recently we've had a request to be seen by a guy who lives in the Caribbean. Now, we don't normally do home visits, but we might consider it for him. The Men's Health Clinic satellite clinic now extends to the Caribbean. Woohoo! So it is incredibly important to realise that your health is integral to your well-being. That should be an obvious comment, and you should place your trust in the right hands.